Thank you, Bill. Thanks to the committee for the invitation, and I invite any of you to stand or dance during the presentation so that your mind is fully alert. So I want to bring us the global lessons for physical activity promotion to the U.S. There are so many great things going on around the world that we can learn from, and I want to help us do that. So the outline is I'm going to give a brief overview of disparities in physical activity and related environments in the U.S., but mostly I'm going to talk about examples of significant physical activity initiatives internationally that can inspire and instruct us. And as a follow-up to Fiona Bull's presentation, I am going to give examples in each of the 4 categories of interventions that she discussed. And included in that, I'm going to mention at least a couple of actions that could reduce U.S. disparities in physical activity and opportunities for activity. So this is national U.S. data, National Health Interview Survey. This is walking for transport in blue and for leisure in orange. Across 4 different race ethnic categories. And you can see that there are some differences. There aren't many differences in the blue, in the transport walking. But you can see that the whites have the lowest by a little bit, not by much. There are bigger differences in leisure time walking. And you can see that with particularly lower levels among African Americans and Latinos. So those are kind of the disparities that we need to be paying attention to. So the disparities are different depending on the domain of activity. So if we were to look at occupational activity, it would be different still. Income disparities in our environments, or the activity friendliness of our environments in the U.S. Turns out to be some people used to think, oh, that literature is very inconsistent. Well, based on some studies that we've done, looking very carefully at the quality of streetscapes, the quality of parks in different parts of the country, my conclusion is that the disparities in the quality of activity environments are location specific. All right, so it's not one pattern across the country. It depends on where you are in the country. And so if you want to know about the disparities in quality of environments in your city, you need to study your city. You need local data. And let's say if you compare these 2 places, on the left they're both walkable areas. Mixed use, a mixture of shops and residences. On the left is a lower income area in Baltimore. On the right, clearly a more affluent area. So they're both functional, but one is more pleasant to walk in. And we see disparities fairly often in the safety characteristics. Yeah, those are not so apparent in these pictures, but sometimes the street crossings will be less safe in lower income areas. But this is a pitch about needing local data. Here's another type of disparities, implementation of policies. Angie Craddock at Harvard did a study on disparities in implementation of federally funded bicycle and pedestrian projects. And she found that that counties with persistent poverty or low educational status were less likely to obtain funding for such projects or to implement projects. All right, so there's a policy disparities. But so there's a need for action to deal with these disparities. And so what can we learn from different countries? So here is on the left, this is a ciclovia or open street in Guadalajara, Mexico. On the right is a little activity break in the South African school. So we're going to start with creating active societies. So this should look familiar from Fiona's presentation. And I want to alert you to a relatively new supplement to preventive medicine on promoting physical activity in public spaces. So this is something that we don't do very well here. But this supplement is full of reports and evaluations of interventions in other countries where they actually do physical activity out in the open, where people can see them. So in my mind, that's creating a more active society where everybody sees everybody else being active. This is Ciclovia. This is in the mothership, Bogota. Where they've been doing this for more than 30 years. And one of the nicknames of Ciclovia, where you close down lots of streets and close it down to cars and let people take over the streets, is Miles of Smiles. Because people are just having a fantastic time, and you see everybody can come. Kids, dogs, bikes, everybody. Many people don't know that the reason that Ciclovia was started in Bogota was for equity purposes. Because poor people said, well, you have all these streets, but we don't have cars, so we can't get anything out of the streets. So they said, okay, we'll close down the streets every Sunday and holiday. And it just got bigger and bigger and bigger, and everybody could come out. And the routes go through neighborhoods of all types. And the good news is that there's been a lot of dissemination of this program in Latin America and the U.S. The only problem is, in the U.S., they're much less frequent and much shorter. So we're not really changing society with these. It's not a part of our culture. It's a special event that nobody pays much attention to. But in Bogota, there's a city department with at least 5 people that organizes everything, including volunteers. So there's one. In Brazil, they have what they call these academias da saúde. And it's a health academy. Again, it's physical activity in public spaces. And here's a couple of pictures of them. And you can see that this has been disseminated throughout Brazil. At one point, there was $1 billion investment to get these programs all over Brazil. With the more recent political chaos, I don't know what's happened to this, but it's an example of here's a program that was homegrown. People liked it. It was very positive, created safer spaces, and it grew pretty tremendously. Why don't we do that? Okay, what about creating active environments? I want to give you what I think are a couple of good, if not inspiring, examples of this. One, I just heard on the radio. I was listening to the Here and Now show, October 1, and they said, we're going to tell you about this town in Spain that banned cars from the center of the city. No more cars in the center of the city, and you can see that. That's Pontevedra on the old one on the left, full of traffic, and now on the right, not quite full of people, but welcoming of people. And so it's gotten all kinds of worldwide press, and for me, this is paradise. And the mayor said, well, it was a big change, but I've had no complaints. I don't know if we would get the same reaction here. And I sent this around, and a colleague from Spain said, oh yeah, there's lots of cities and towns in Spain that are doing the same thing. So, and what about bicycling? In the United States, 50% of all trips in the U.S. are bikeable distance of 4 or 5 miles or less. 50%. Think of what we could do to pollution, to physical activity, to a saner, safer place. And here are cities around the world that started off with 1% of trips by biking or less and then went up. Here are more cities from mostly in Europe, but some in U.S. That started off well above 5%, 1%, and kept going up. So creating bikeable cities is something that we know how to do. The world knows how to do. We're in the U.S. 1%. That's the overall. But look at this. Stockholm decided we're going to become a bikeable city. Their vision is to double the percentage of cyclists by 2030, and their attitude is snow. What snow? Snow is unimportant. It's how you dress, and you can see that bicyclist is ready to go. So yes. There are different ways of doing things. What about creating active people? I want to highlight something our neighbors have been doing since 1971, most of the time. They call it participaction, with the emphasis on action. And it's the longest lasting physical activity promotion program in the world, though it lapsed there for a few years. It's mostly government supported, but now it's mostly a public-private partnership. The main emphasis is on media campaigns, public service announcements. They want to change social norms, and they want partnerships to promote messages. So they've been doing this a long time and actually putting money into it. And Canada is one of the very few countries with increasing trend of physical activity. Agitamundo. How many of you have heard of Agitamundo? Okay, just a few of you. Well, if you were in Latin America, you would have heard of it because they believe in mass action, getting lots of people active. And you can see one of their examples here. And they started out small in the state of Sao Paulo, which is only like 40 million people. And they would have every year, they would have programs to get all schools active and going out in the community, and all senior centers and all workplaces. They just massively mobilize. So we could learn a lot from them as well. Getting kids active in school. Physical education is problematic in quantity and quality in many countries, but Finland is an exception. They consider physical activity a right for children. They require 2 hours a day of physical activity in school, much of it outdoors. And is it harming their education? No. Finland is almost always number 1 in world rankings of education. 2 hours of physical activity a day. The opposite of what we do here. And they do better academically. Creating active systems. The example I want to give you on this one is Thailand. The Thai Health Promotion Foundation, or Thai Health. This was, there's a law passed in 2001 to do this, and they support not just physical activity, but eating and non-smoking and less drinking. And they want to be a catalytic funder for other things. They want to produce a culture of health. And how does this work? Through taxes. They tax tobacco, they tax alcohol, and they put it into Thai Health. So it's funded, it's well funded, it's sustainably funded. And so that's their commitment to health. And you can see it's not gigantic pots of money, but it's a more stable funding than we have. And so then they do a lot of work with that, which I won't go into. Last thing I want to talk about. In most minority communities in U.S. today, when they see bicycles come into their neighborhood, they get worried about gentrification and getting displaced. They approach this differently in South Africa. So this is the Bicycle Empowerment Network. And they want to use bicycles to alleviate poverty and to have low-cost transportation. And why is that important? Well, here's an interesting little study done by a very talented colleague in Australia, postdoc, Jeremy Rochelle. And they looked at the economic impact of different transportation scenarios. And scenario 1, 2 cars in a family and 2 commuters. Scenario 2, 1 car and one of the commuters uses public transit. And then scenarios 3 and 4, no cars. And so if you look here, if you're a high income person, car expense is a very small part of your income. So the scenarios make no difference. If you're medium income, it makes a little bit of difference. If you don't have cars, you've got a lot more disposable income. Look at the low income. If you have 1 or 2 cars, you've got 1/3 or about 1/2 of your income going into that. Just to get to work. You're spending half of your income just getting to work. And whereas if you can take public transit, or if you could bike or walk to where you needed to go, you have your standard of living would be much better. So anyway, I think that's food for thought here about different ways of looking at things. So key lessons. A lot of great things going on around the world, examples in every category of the Global Action Plan for Physical Activity. Many have been widely implemented, few have been evaluated. We're the opposite here. We've evaluated many and implemented almost nothing on a broad scale. So thank you very much.